Hello everyone. So in this video we are going to talk about radiation sickness and its management. So let's start by understanding what actually is radiation sickness. So these are the ionizing radiations like the one which we get through the X-ray exposure, the CT scans, or the non-ionizing radiation like from the sun rays, the infrared rays, the microwaves. These cause molecular damage within our cell and lead to a different kind of manifestation which can be systemic effect, the deterministic effects, and stochastic effect. And we study these in the term of acute radiation sickness. Following a radiation exposure to a particular dose, the person develops different effect of the radiation which we are going to study. Generally, when there is a mild acute radiation sickness, we see the patient develops nausea, vomiting, and malaise. Within few days, he will develop lymphopenia, and following 2 to 3 weeks, he will develop decreasing WBC and platelets. So, what are the deterministic effect which we see in the radiation exposure? Now, these deterministic effects are seen generally in the tissues in the body which are actively dividing. Now, these tissues include the hematopoietic cells, the GI mucosa. Okay, these are replaced daily on the daily basis, so they are very actively dividing cells, and these are what are affected most in our radiation exposure. The hematopoietic cells, the GI mucosa, the skin cells, the CNS neurons, the gonads that are sperms, and the ovarian cells that are oocytes. So the deterministic effect in the hematopoietic system is there occurs lymphocyte depletion, and this is the most sensitive indicator of a bone marrow injury. Okay, whenever there is exposure to fatal dose of the radiation, there is bone marrow aplasia, and this is the most common cause of death in the case of radiation. The GI mucosal toxicity will lead to atrophy of the GI mucosa, plus there will be diarrhea, vomiting, sepsis, and dehydration. The skin changes include radiation dermatitis that starts with a erythema over skin that develops into a purpura and then a blister. If the exposure is more than 5 gray, the patient develops loss of hair. So now it must be clear why a patient receiving radiotherapy for a malignancy has loss of hairs after a radiotherapy. The CNS deterministic effects include disorientation, coma, nausea, and vomiting. Okay, if the exposure is more than 35 gray, the patient develops cerebral edema, and this cerebral edema, if lasts for more than 36 hours, will lead to a permanent neurological deficit. Also, gonads, where the cells, the sperms are actively dividing, the radiation exposure can lead to a temporary or the permanent sterility. The eye shows a radiation cataract, and the lungs will show an acute inflammation and fibrosis. The point to be noted is that the thyroid gland also is affected in this case. Now this is because the thyroid gland has a concentrated iodine, and that this is why the concentrated iodine is more of like attracting the radiations and is sensitive even to the low dose of radiation. So these are the deterministic effects seen in the case of acute radiation exposure. Talking about the stochastic effect. Now stochastic means by chance effect. Now these chance effects seen in the case of radiation depend on the dose of radiation. Generally these are the malignancy that are seen in the radiation exposure and the teratogenicity. Now the malignancy most commonly seen is acute myeloid leukemia. This develops after a latent period of 2 to 5 years following the radiation exposure. The other thing can be solid tumors like that of skin, thyroid, or salivary gland. These develop after a latent period of 10 to 20 years. So these were the effect of acute radiation sickness. Now we will talk about management of the acute radiation sickness. So these are easy to understand if we have understood the deterministic effect. So when there is low dose exposure, we need to manage the deterministic effect. Like the GI mucosa was undergoing toxicity, we had diarrhea, vomiting, so we need to hydrate the patient. There was sepsis, so we need to control the sepsis. Okay, the important thing to control here is the bone marrow aplasia, because this is the most common cause of death. So in this case, after controlling the hydration sepsis, we need to manage the bone marrow aplasia. How we will do that? We can give WBC colony stimulation or hemopoietic stem cell transplantation. Also, the blister forms need to be treated. Also, in some cases where radioisotopes within the body are present, we need to chelate them with different agent. Like when within the body we have 137 cesium, we use Prussian blue to chelate this radioisotope. The other thing we need to do is avoid unnecessary exposure by different diagnostic modalities. Now, this is an important point to note. Whenever, uh, whenever you are going for any diagnostic investigation, please be aware to not go for unnecessary investigations. The final thing is the one working in the area of the radiation exposure should wear a lead apron, because it decreases the penetration power of radiations. So this is what you needed to know about a bit of radiation sickness. Thanks for watching.